Today we are going to be looking at an eye disease called glaucoma. We're going to be looking at an eye disease called glaucoma. Glaucoma is a disease that damages the eye optic nerve. It usually happens when the fluid is built up in the front of the eye. It happens when the fluid is built up in front of the eye. We have two major types of glaucoma. Number one is primary open angle glaucoma. And the second one is angle closure glaucoma. The primary angle glaucoma often happen no nearly symptoms, but can lead to a slow loss of peripheral vision. An angle closure glaucoma can be acute, causing sudden severe eye pain, blunt visions, sudden severe eye pain, a halo round light, and a rapid increase in eye pressure. These are the signs of glaucomas. These are the signs of the primary open glaucomas. While the second one, the angle closure, you also call closed angle glaucoma, is a type of glaucoma where the iris block fluid from drying out the eye. It blocks fluid that comes out from the eye. Having known the two types of glaucoma, I would like us to see the signs that the patient who is suffering from this kind of eye problem called glaucoma will be having. Number one sign is that your vision suddenly blurry. The vision is suddenly blurry. When you don't see clearly, it's a sign of glaucoma. When something that is in front of you, you can't see it clearly. Whether in front of you or nearby, you can't see it clearly. Your eye become blurry. It is sign of glaucoma. Number two, signs of glaucoma is having severe eye pain. You suddenly start having severe eye pain without anything hitting you in the eye. You know that your eye is developing this disease called glaucoma. The third one is constant headache. When you're having constant headache. So some of the constant headache you're having may not be signs of malaria or typhoid. It may be signs of glaucoma. The fourth signs or symptoms are red or eye redness. When you're having your eye begin to red, eye turned red, or redness of eye. It is signs of glaucoma. Feeling sick to your stomach. Nice. When you are feeling sick to your stomach, it's called nuisance. It is signs of glaucoma. The last one is eye that look hazy. Particularly infants. It is signs of glaucoma. What are the risk factors of this glaucoma? What are the risk factors? Who normally catch up with this glaucoma? Who are the group of people that suffers this glaucoma most? Number one is family factors or history. When your member of the family suffer from this kind of disease called glaucoma, mostly it is inherited as a family history. Number two is age. Factors that contribute to glaucoma is age. When your age is advanced, when you are having an advanced age, this sickness, you may likely catch up with it. The third factors that causes this sickness called glaucoma is race. Like African race are more prone to glaucoma than the white. We the black are more prone to this sickness than the white. The last and not the least is eye disease. Eye disease is also the factors that lead to this glaucoma. Eye disease like conjunctivitis. Conjunctivitis are also embedded with this sickness called glaucoma. So, having known what glaucoma is, let's look at the treatment that can be given to the patients that have this kind of disease called glaucoma. As I said earlier, glaucoma is an eye disease. So glaucoma is treated with prescription eye drop, laser surgery, or other type of surgery. Often starting with eye drop to lower the symptoms, to lower the intraocular pressures. We normally use eye drop for a start to lower or to prevent the eye visions loss, or to stop existing drainage or existing damage caused by this disease that cannot be reversed. Other treatments for this sickness called glaucoma are laser therapy. These are used for open angle glaucoma. This laser therapy is used for open angle glaucoma. It creates a new opening in the iris to help the fluid drain. This kind of treatment or medication is used to drain out the fluid from the eye or from the eye iris. The second one is eye drop, which I mentioned earlier. Eye drop is the most commonly initial treatment given to a patient having glaucoma. The third medication is oral medication. Oral medication. In some cases, oral medication may be prescribed alongside with the person suffering from this sickness. These are treatment given to a patient having this disease called glaucoma. In my early stage, I said this season, as we are entering the dry season, is mostly the time this sickness is being contacted by some people, like dust and other bacteria that cause this sickness. Some are airborne, so you need to be careful anytime you use your eyes close to your eye. Make sure your hand is being washed always. Keep it neat so that we not import bacteria that will cause this eye disease called glaucoma. Thank you for watching. Like this video, share it to people who may need it. You may save a life by doing that. Meanwhile, wait for my next update Also drop a comment so that I know how to assist you. If you need a treatment for this glaucoma, we have the best doctor that deal with this sickness called glaucoma. Thank you.